Hi people, Tracy Hudson here from the HR department. I wanted to talk to you today about ill health with your employees. So it might be that you've got somebody off short-term sick, just sporadic absences every now and again, and it's frustrating because you feel like you can't rely on them. Or it might be that you've got somebody off sick longer term, maybe a few weeks or a few months, and again you're getting frustrated because you're just getting a fit note every month from the GP signing them off for another month or a few weeks or whatever it is. And that can be really infuriating, especially in a small business, because we don't have big teams in small businesses. There isn't anyone who can just step in and cover. It is a real problem when somebody's off sick or they're not coming in reliable. You feel like you can't rely on them. So my advice in these scenarios is always to contact occupational health early. Now, I know you might be thinking, I'm a small business, I don't have occupational health, I can't do that. That's for corporates. There are outsourced occupational health companies, just in the same as we're an outsourced HR business. So it's really important that you find a partner, an occupational health partner that you trust and that you work with, so that when these situations happen, you can refer early. And, as I said, we're not talking hundreds of pounds. It's worth investing a small amount of money early on in the process to get some proper advice so that that employee can come back quicker. A way that we see it working really well is somebody who's off long-term sick and you're getting those doctor's notes over and over again. If you refer them to occupational health and get some advice early on, there may well be things that they can do so that they can come into work that a doctor won't have thought of, because that's not their job. It's your job to think of that, and it's occupational health's job to think of that. So we find it works really well when you refer to occupational health. They can have an assessment, and then you will get a report with adjustments for you to think about. All you've got to do is consider these adjustments, to think about what you could put into place so that that employee can come back into work. If they can come back in, that's great, and then you do that for a temporary period of time until they're back on their feet properly, and then the adjustments are no longer needed. Or it might be if you've got somebody with a long-term chronic condition that they need those adjustments on a more permanent basis. But at least you know what you're dealing with. The role that HR play in this situation is that we can help advise you on what adjustments are reasonable for you to put into place. So we can challenge you when you say you can't do something. We really talk through why you can't do that thing to enable your employee to come back into work. Because I think when you first get an occupational health report, it can feel quite overwhelming, and you just see kind of things are going to cost you money, but that's really not the case. You don't have to do anything that your business can't afford. You don't have to do anything that's unreasonable. You literally have to put in reasonable adjustments. That word reasonable is really important. So that's where we come in. We advise you on what to do. So if you have a situation at the moment where you have somebody off long-term sick, or somebody who's just not coming into work reliably, or you might have had somebody who's just been diagnosed with a new condition and you want to support them but you don't know how, then please get in touch with me. I'd love to talk it through with you to see how we can help.